5 health checkups you should avoid after 60 that may harm you more than help. There's a hidden reality behind senior healthcare that almost no one warns you about. Not your trusted doctor, not your insurance company, and certainly not the clinics benefiting from it all. Every single year, millions of older adults walk into exam rooms believing they're doing the right thing, believing they're taking preventive steps to stay healthy and independent. But what if I told you that some of the most common routine tests, the ones you've been told are necessary and responsible, could actually be quietly nudging you toward dangerous treatments, unnecessary procedures, frightening diagnoses, and even long-term harm? Research now reveals that up to 37% of medical tests performed on seniors lead directly to overtreatment, misdiagnosis, or complications that could have been completely avoided. And here's the shocking truth. Almost every senior, 99%, has no idea they're being excessively tested. Even worse, one of these tests, the number one entry on our countdown, is now estimated to cause roughly 5% of all cancers in the United States. That's the same percentage linked to drinking alcohol every day. Yet you'll never hear this announced in a waiting room. You'll never see it on a clinic poster. And you certainly won't hear your insurance carrier volunteer this information. The truth is buried deep in scientific literature, tucked away from the people who need it most. Seniors trying to stay healthy, informed, and safe. But today, we are bringing those hidden truths into the light. In this video, we are counting down the 5 checkups older adults should think twice about after age 70, and the disturbing reasons they may do far more harm than good. Every point is backed by real scientific findings, eye-opening patient stories, and insights you won't hear during your annual exam. And trust me, once we reach number 2, you'll understand exactly why so many seniors are unknowingly put at risk. Before we dive in, let us know in the comments where you're watching from, your age, and whether you've ever regretted a medical test or procedure. Do you feel seniors are being tested too much? We answer every comment personally. And if you find this helpful, be sure to like the video and subscribe for more expert senior health content delivered straight to you. Now, let's begin our countdown with a test that looks innocent on the surface, but can quietly disrupt your life more than you'd ever expect. Number 5. The bone density scan. When most people hear the term bone density scan, they imagine one of the gentlest procedures in all of medicine. No needles, no discomfort. A quick and painless image that simply tells you how strong your bones are. The DEXA scan, as it's formally known, measures bone density to determine the presence of osteoporosis. But what seniors rarely hear is that after age 70, these scan results almost always show decreased density, not because you're in danger, but because it's the natural, expected process of aging. Bone thinning at this age is normal, universal, and not always a medical problem. The danger isn't the scan itself, it's what commonly happens next. Many seniors are quickly placed on strong medications like bisphosphonates, drugs that can cause severe digestive issues, inflammation of the esophagus, and in rare but horrifying cases, jaw osteonecrosis, where jawbone tissue begins to die. Even more frustrating, the actual benefit of these medications for seniors without fractures or falls is remarkably small. One extensive study that followed over 1,200 women found that treating mild bone loss with these medications only reduced fracture risk by 0.3% over 5 years. A tiny sliver of benefit, nowhere near large enough to justify the side effects so many people experience. Let me tell you about Rose, a 76-year-old retired piano teacher who'd never broken a bone, never fallen, and walked daily. Her doctor suggested a DEXA scan during her routine checkup. It showed osteopenia, a term that often sounds frightening but simply means mild bone loss that most older adults have. Nevertheless, she was immediately placed on a bisphosphonate. Within weeks, Rose developed severe reflux. Soon after, she developed intense jaw pain, making eating uncomfortable and playing piano impossible. When she came to us, we adjusted her plan. She transitioned to vitamin D support, a calcium-rich diet including leafy greens and sardines, and safe resistance exercises. Within a year, she was performing again with stronger legs, better balance, and no fractures. Often, lifestyle choices, gentle strength training, balance practice, proper nutrition reduce fracture risk far more than medication. In fact, These methods can lower fracture risk by over 20%, according to new research. So before you let a concerning scan number push you into medication with serious side effects, remember that context matters, and aging bones aren't automatically dangerous bones. But if you think this test can cause stress, our next one can lead to emotional spirals, frightening diagnoses, and even unnecessary brain procedures. Let's move to number 4. Number 4. Brain MRI for memory loss. When older adults start misplacing keys, forgetting names, or losing track of conversations, fear rises fast. The looming shadow of dementia pushes both patients and doctors toward brain imaging. So the MRI is ordered. It's a detailed scan, and it seems like the logical step. But what most seniors don't know is that almost every MRI in people over 70 reveals something. Tiny white matter changes, mild shrinkage, or structural variations that are simply normal aging patterns. The problem isn't the scan, it's the interpretation. Many doctors, especially less experienced ones, present these age-appropriate findings in ways that sound alarming. Patients panic, families panic, and from there, a cascade begins. More scans, spinal taps, neurological referrals, and sometimes even invasive procedures that carry real risks and offer almost no benefit. A 2021 review of more than 3,000 MRIs in adults aged 70 to 85 showed that while 86% had abnormalities, only 3% were linked to treatable conditions. That means 97% of patients underwent unnecessary stress, unnecessary worry, and in many cases, unnecessary procedures. Even more troubling, around 12% were funneled into invasive follow-up tests that carried significant risks but offered almost no diagnostic clarity. One such patient was George, a 74-year-old retired engineer. Sharp-minded, analytical, and active, he began noticing small lapses like misplacing his glasses or forgetting a name. His doctor suggested a brain MRI to rule things out. The scan found white matter changes, something extremely common for his age. But instead of reassurance, the news terrified him. Convinced he was developing dementia, he stopped driving, withdrew socially, and fell into anxiety. When he eventually came to us, a simple cognitive test showed that his memory was normal. His forgetfulness was typical age-related change compounded by worry. After focusing on hydration, sleep, and cognitive exercises, his memory improved, and he returned to his normal routines. A brain MRI should not be the first step for mild forgetfulness. A simple cognitive screening test is quicker, cheaper, safer, and far more accurate in determining what's actually happening. Only in cases of dramatic changes, seizures, sudden behavior shifts, or rapid decline does an MRI become truly helpful. And just as MRI results can lead seniors down a dangerous path of fear and invasive testing, the next test on our list can guide fully healthy seniors toward surgeries that were never necessary. Let's go to number 3. Number 3. The cardiac stress test. This test is one of the most overused in adults over 70. It's often suggested for vague symptoms like mild fatigue, occasional chest tightness, or even simple age-related slowing down. The idea is to examine the heart under stress to detect blockages. But here's the hidden truth. Stress tests in older adults can be wildly inaccurate. False positives, tests that wrongly show abnormalities, happen as much as 40% of the time. That means nearly half of all concerning results in seniors may be false alarms. And false alarms in heart testing are dangerous. They lead to referrals for angiograms, catheterizations, and stent placements, procedures that carry significant risks including bleeding, kidney injury, infection, and prolonged hospitalization. A major study from 2017 revealed that over half the stents inserted after stress test referrals were done in seniors with no real symptoms or benefit. Their survival didn't improve. Their quality of life didn't improve. Yet they were exposed to life-altering complications. Raymond, a 75-year-old retired postman, learned this painfully. He walked daily, ate well, and had no true heart symptoms. During a checkup, he casually mentioned he felt winded climbing hills. His doctor recommended a stress test just to be safe. The results were unclear, so he was sent for a catheterization. A mild narrowing was found, and a stent was placed. But that night, Raymond developed a serious reaction to the contrast dye. His kidneys were injured, and he spent almost a week in the hospital. In the end, his fatigue had nothing to do with his heart. He'd been dehydrated and skipping meals. If you're not experiencing clear cardiac symptoms, exertional chest pain, shortness of breath during activity, or extreme fatigue, stress tests can do more harm than good. Safer options like resting EKGs or coronary calcium scans often provide far more helpful information with fewer risks. But while stress tests can lead to unnecessary heart procedures, the next test on our list has even more immediate risks for older adults and far fewer benefits. Number 2. Colonoscopy. Most people over 50 have been told for decades that colonoscopies save lives, and for many younger patients, they do. But after age 70, and especially beyond 75, the risk profile flips. The preparation involves powerful laxatives that can dehydrate older adults quickly, leading to dizziness, kidney issues, and falls. Sedation impacts senior brains more strongly and can cause confusion, memory issues, or prolonged grogginess. And during the procedure itself, the risks rise sharply. Bleeding, bowel perforation, heart rhythm issues during sedation all become more common with age. A major study involving more than 1 million Medicare patients found that for every 1,000 colonoscopies in people over 75, only about 2 lives were saved. But more than 20 people, 10 times as many, experienced significant complications. And when the polyps removed are often small and extremely slow-growing, removing them may pose more danger than leaving them alone. Dana, a 73-year-old baker and grandmother, learned this the hard way. With no symptoms, no bleeding, and 2 previous clean colonoscopies, she agreed to another screening after pressure from a new doctor. A small polyp was removed. That night, she collapsed from severe abdominal pain. A bowel perforation had occurred. She spent over a week in the hospital and months recovering. Had her medical history been properly reviewed, she would have realized she didn't need the test at all. Today, experts recommend stopping routine colonoscopy at age 75 for most people. For those in excellent health who want continued screening, non-invasive stool tests like the FIT test offer a safer alternative without sedation, preparation, or procedural risks. And that brings us to the most dangerous, most misleading, and most unnecessarily harmful medical tests seniors undergo. The number 1 test that older adults should avoid almost entirely. Number 1. Annual full-body CT scans. Full-body CT scans are marketed as cutting-edge preventive care, a way to catch hidden diseases early. But behind that polished promise lies one of the most harmful trends in modern medicine. A full-body CT scan exposes you to a massive dose of radiation, 10 to 20 millisieverts, equal to about 500 chest X-rays. This level of radiation isn't benign. Current modeling suggests full-body CT scanning may now be responsible for as many as 5% of all cancers in the United States, placing it in the same category as daily alcohol consumption. But radiation isn't the only risk. Full-body scans pick up countless harmless findings, tiny cysts, calcifications, nodules that are simply normal signs of aging. Yet once they're detected, panic begins. More tests follow, more imaging, biopsies, specialist appointments. Seniors who felt perfectly healthy can suddenly find themselves trapped in a cycle of fear and procedures. Marcus, an 80-year-old martial arts instructor, was one of them. He felt great, active, and independent. During a high-end senior checkup package at a private clinic, he underwent a full-body CT scan. It showed a tiny 3-millimeter lung nodule, almost certainly harmless. But instead of reassurance, he was sent for more imaging, then a PET scan, and finally a needle biopsy. The biopsy collapsed part of his lung and landed him in the hospital for weeks. The result? The nodule was benign. Leading radiology organizations have now issued strong warnings. Full-body CT scans should never be used for routine screening in adults without symptoms. There's no evidence they save lives, and overwhelming evidence they cause harm. If you have significant symptoms, persistent cough, weight loss, blood in your sputum, targeted scans are appropriate. But scanning the entire body without symptoms is like sweeping your home with a searchlight so strong it can burn the furniture. And there you have it. 5 checkups older adults should think twice about. Modern medicine is powerful, But that doesn't mean more tests always equal better outcomes. Sometimes, the wisest and safest approach is asking questions, understanding your true risks, and choosing tests supported by strong evidence, not fear. Now, we'd love to hear from you. Have you or a loved one ever experienced complications from a test or procedure that turned out to be unnecessary? Share your story in the comments below. We read every single one. If you found this eye-opening, be sure to like the video, subscribe for more interesting videos. Thank you for watching.